As chair of the Health, Education, Labor, and Pensions Committee in the Senate, the committee that drafted large portions of the Affordable Care Act, and looking back at all of the hearings we had, the long markup sessions, working across the aisle with Republicans, working with the administration, finally getting it passed, signed into law, this is a great day. There has been a cloud hanging over it because of those who don't want to reform the healthcare system. They wanted to keep the insurance companies in charge. Well, we said, no, we're going to change the system. We're going to reform the system and make it work for people, not just for insurance companies. Well, there were those out there that didn't want to change. They didn't want to reform the system. And so they brought cases in courts, and as we know, it wound its way through the courts, some deciding yes, some deciding no, and went to the Supreme Court. I remember being there this spring for the arguments on this law, and we have been waiting since for the Supreme Court to make its decision. Well, this morning, the Supreme Court gave a resounding confirmation that the Affordable Care Act is indeed constitutional. Now, some have been saying that President Obama wins on this, or the Democrats win, or Republicans lose, that kind of thing. I don't see it that way. What I see it as is a great victory for the American people, for the businesses of America, for our economy. That's what this is all about. It moves us forward so that every American, every single American, will have quality, affordable health care coverage, something we've never done in this country. That's why this is such a landmark bill and such a landmark decision by the Supreme Court. The Supreme Court's decision allows us to move ahead, replacing what I've often called a sick care system. A system that will maybe get to you, if you're lucky, in the emergency room if you're sick, but not one that gets to you before to keep you healthy. That's what the Affordable Care Act is moving towards. A system with more preventative health care, more promoting of wellness and keeping people healthy in the first place, by giving them the coverage that they can use to access preventable, affordable wellness and preventative health care. The Supreme Court's made it clear, what we've known all along, that those who want to block this law and who are now clamoring to repeal it, they are on the wrong side of history. They are on the side of history that you could go all the way back, that didn't want to have a Social Security system. There were those. They were on the wrong side of history. There were those who didn't want to have a Medicare system. They were on the wrong side of history. Those who want to repeal this law can stand with them. They can stand with them in history. But I think history has shown that every time we expand rights of people to certain basic things that people need in their lives, that we become a stronger country, a more unified country, a better country, with more opportunity for all. For those of us who believe that quality, affordable health care is a right and not a privilege, this is a great victory. So now I see that some in the House have now scheduled a vote to repeal it after we get back from the 4th of July break. Well, they've already voted to repeal it. I guess they're going to vote to repeal it again. They're on the wrong side of history. And you know, I call upon my Republican friends in the House and in the Senate. It's over. This is constitutional. Now let's work together to make it so it's implemented, that it works for everyone. I say to my Republican friends, I've never said that the Affordable Care Act is like the Ten Commandments chiseled in stone for all eternity. I've often likened it to a starter home, which could add some additions, make some improvements as we go along. But at least that starter home has put a roof over our heads. A roof that will get quality, affordable health care insurance to every American. So I say to my Republican friends, bring your toolkits. Bring your toolkits. If you want to make it better and improve it, bring your toolkits. Don't bring a sledgehammer. Don't bring a sledgehammer to break it down and try to repeal it. That's a non-starter. So let's work together, put politics behind us, and make this bill work for everyone. Make it work for every American. The justices have spoken. Now it's time for us to get back to work, to build a reformed health care system that works not just for the healthy and the wealthy, but for all Americans. This is a victory. It is not a victory for President Obama. It is not a victory for my committee or anyone else around here. What this is, it's a victory to make sure that no one in the future is ever denied health care coverage because he or she got cancer. Make sure that no one in the future will be denied quality, affordable health care coverage because you had diabetes. It's a victory for families who have had a child that needed intensive, very expensive health care coverage to make sure that that child would live and grow and be able to take full part in our societies. Sometimes those costs are extremely high. In the past, there have been annual limits. Annual limits. If you go above that, you got to pay out of pocket. Or lifetime caps. How many women have I met in the past who have had breast cancer and had to have intensive treatments for a period of time, but they were bumped up against a lifetime cap and they couldn't pay above that. They had to pay out of their own pocket. So this is who it's a victory for. It's a victory for families so that they don't face lifetime caps and annual caps. It's a victory for every family in America to ensure that their child can stay on their family's policy until they're age 26. That's who wins here. Ordinary, hardworking families in America. It's a victory for hardworking families to make sure that insurance companies have to provide cost-effective, life-saving, preventative care at no cost to get to people early on to keep them healthy in the first place. It is a victory for working families, so no longer do they have to choose between paying for health insurance or other critical family needs, like food, shelter, transportation, education. That's what this is about. That's what this victory is all about. Not one person. It is a victory for America's families. And I say to those who now want to repeal it, who are going to start to make a political issue out of this, you're on the wrong side of history. The American people will now begin to take a look at this bill in a new light, that it is constitutional, it will be implemented, and what's in it for us. And I just went through what's in it for every American family. And American people will not want to go backward. They will not want to repeal this law. There may be improvements that we can make as we go along. That's fine. But I say woe to those who vote to repeal this bill. The American people will hold you accountable for for being on the wrong side of history, the wrong side of progress, the wrong side of ensuring that every American family has quality, affordable health care in America. Madam President, I yield the floor, and I note the absence of a quorum.